And it is 9:31 now. I guess it wanted to go back to music. But it's not time for music because today it's time for the Friday version of Tillamook Today. Good morning.
Good morning.
How are you?
You're right. It is the Friday version of Tillamook Today.
Yes.
Because you have your knucklehead guest host, Stacie Zuercher, here from Northwest Senior and
I
Disability
wouldn't call
Services.
you a knucklehead.
Just kidding.
You're doing great,
Thank
Stacie.
you.
Have a
I
good
love
time.
it. It's fun stuff. So, again, this is Stacie from Northwest Senior and Disability Services, and I am here as a guest host with the Rinehart Clinic posse. I've got Katie Boner, who is the Insurance Enrollment Navigator, Alice Jeffers, the Outreach Coordinator, and Keri Scott, the Director of Quality. Did I get that
Stacie.
right?
Yes. Thanks for having us.
Yeah, welcome. I'm very excited that you're here. So the Rinehart Clinic is up in Wheeler, and you guys are a full one-stop shop for care, right?
Yes, we are.
Yeah. So I'm really excited. I've gotten to know these girls over the last this year really, as we've been planning events and things for the Year of Health and Wellness. And that's a little bit about what we're going to talk about today. And hot on the agenda is today's event in Bay City, the Good Food, Great Medicine, a lifestyle prescription for all ages with Dr. Miles Hassel.
Super cool. We have been selling his cookbook at our clinic for about 5 years. So
I didn't realize 5 years.
I'm very excited to meet him.
And it's a great cookbook, isn't it?
Yes. It's
Have you
wonderful.
guys tried any of the recipes?
Yes.
Yeah.
Well, I'm a vegetarian, so I have absolutely, and they're yummy. So it's not just good food, but it's yummy food.
It's not just good food, it's great medicine, right?
Whoa. Yow.
So, and exactly, we're all jacked up about the yow today, aren't we? The Year of
Yes.
Health and Wellness is what we're talking
exciting
about. So we've kind of sold it now that food sounds really good. And so a great way to try it is to come to today's event. I hope you've RSVP'd. We're going to have Dr. Miles Hassel up in Bay City. It's a little change, right? If you want to talk about that a little bit.
So we start at Bay City Fresh, which is where the food will be. And then we're going to head on over to City Hall and listen to Dr. Hassel speak about his book and his lifestyle.
Yeah. And I'm trying to remember the menu. It was tabbouleh salad and warm lentil salad and coconut macaroons, and there was all kinds of good things going on. And then in addition to that, tomorrow there's cooking classes throughout the county, which will be fun as well.
Yes.
So
I actually had a peek at the macaroons, and they look pretty awesome.
they did, didn't they? I saw them too. I was like, uh-oh, that's going to be dangerous later. So yes, we originally were gonna have it at Fresh for the lecture, but there is a change. So for those of you listening that are planning to go to the event today, we just want to make sure you know we're gonna start at Fresh Cafe at 11 o'clock for lunch, and then we're all gonna schlep around the corner. We'll get a nice little brisk walk out in the fresh air before we go over to listen to the lecture. And I'm really excited also that Dr. Hassel's going to do a book signing after the event.
Yeah, that's great.
Super cool.
So some of the sponsors that have been involved in this event include the Rinehart Clinic, which you guys have actually donated some of the money to have Dr. Hassel come, which is very appreciated because this, as we know, the Year of Health and Wellness is just a big collaboration. What are some other things that you guys have been up to up there for the Year of Health and Wellness?
So we have a pretty nicely developed employee wellness program. We got together with the staff at a meeting and talked about what we wanted our focus to be. And staff identified that they want their focus to be on nutrition and movement. We have a weight loss competition happening with the staff.
Really?
It's really been a lot of fun.
Yes. Is it like Biggest Loser style? Where
It
you
is
have to
Biggest
get
Loser style, absolutely.
Wow.
Yes.
Okay.
It's posted in a public place.
Yes.
People can see our progress. It has our pictures on there. So
That's
we're really held
amazing.
accountable.
Yes. And it's also educational. We make sure we have educational pieces up there for people to see as well.
Fun.
So one of the other things that staff talked about, in a medical clinic, people like to bring little rewards to us, and quite often they bring sugary treats. So staff talked about the fact that we want to minimize the use of refined sugar on site. So we've done a couple things. Staff is committed not to bring in cookies and cakes and candies to share. And we have removed the artificial sweeteners and artificial creamers and refined sugar from our coffee station for patients.
Wow.
Right?
Yeah.
We've
Has anybody been just devastated? Like, no, I I need my sugar fix.
No, a few people made a few comments, but really no. We've added tea, which we didn't have before, so there's that option. And we provide raw sugar, so people don't have to drink just plain black coffee.
And that's important, that there are substitutes that are just as good.
Yes.
So it's neat that you're providing that. And if I remember right, the last time I was there, you also had a bulletin board with some resources, right? With that little bulletin board in the waiting room that has a lot of good information and facts, which I loved.
Right. That kind of goes along with the changes we made with the coffee station. We have informational sheets about artificial sweeteners and artificial creamers and refined sugar. And then we also have an informational sheet about the health benefits of raw sugar and why we've made that change to raw sugar and gotten rid of all the chemicals, essentially, that we had there before.
Neat.
And I did run this by our Patient Advisory Council just last night to make sure that everyone was on the same page with us. And they were excited that we were making these changes and helping them make healthy choices, too. So.
Fantastic. And so I'm assuming if you're having these challenges that the people, your staff that are engaged are having some successes. Woo, easy for me to say.
Yes. Yes, they are. Can I brag a little bit?
Please,
So,
knock yourself out.
I've lost, since the program started, I've lost 31 pounds.
Wow.
So it's been...
yow.
It's been a great motivation for me. I feel really good about it. We've started a walking club, and there are staff that said, you know what, that doesn't work for me. So they do Pilates and yoga and aerobic exercises in the afternoon before they leave work.
Wow.
Our CEO is approved for a half hour of paid vacation, paid exercise a day.
Really?
And staff are using that. It's a great benefit for us.
That's fantastic. Yes. And 31 pounds. This started the first week in January, right?
Yes.
January 2nd was your first day. So what is today? March 11th. So that's quick.
Yes.
Congratulations.
Yes. Yeah, thank you.
Yeah.
I wonder what you were doing before to have such a drastic change.
Yeah.
I was doing Christmas.
Coconut macaroons.
Everything in moderation.
Yeah, exactly. There's the key.
I am having a macaroon today.
Are you? Well, and portions and moderation, I think, are the key. And all those, I think that all those foods that are going to be there are completely cooked. No trans fats and all that good stuff too. So, we'll take a moment to hear a little word from our sponsors. So mark your calendar. April 1st is rapidly approaching. And what is special about April 1st, you ask? Of course, it is April Fool's Day, but it is also Rosenberg's 10-year anniversary. That's right. It's been 10 years since they bought the store. So in appreciation of all the customers that have shopped there and continue to shop there, they're having an anniversary bash. Hamburgers, hot dogs, pop, cake, and much more. And what makes this anniversary celebration special is the free stuff. I know what you're thinking. Rosenberg's and free stuff seems like an oxymoron, but it's true. All day Friday, stop by and fill out a ticket and put it in the bucket. They'll draw tickets throughout the afternoon. They'll be giving away a 6-tool Milwaukee cordless combo set, a Craftsman 2800 PSI pressure washer, a lawn cart loaded with soil and tools. There will also be other items as well, so stop by and see. The following weekend is the Home and Garden Show, so it's great timing. And if your name wasn't drawn, it will go into a bucket for a grand prize, a $1,500 Rosenberg gift certificate. They'll draw it and other prizes at the show. And Lowton says, thanks for 10 great years. And, of course, we're talking about Lowton Hooley, who is the master of the operations and does a wonderful job. And it's so neat that he is giving back to the community for all of the service that they provide. So build it, plumb it, wire it, paint it. Rosenberg's Builder Supply in Tillamook. That's fantastic.
Yes, we love Rosenberg's at our house. We're remodeling, and we go there frequently.
Oh, I bet. And the people are always so nice. They get you, because I go in and just have the deer in the headlights look immediately. I have no idea what I'm doing. Even, I need to have a key made, and it's a thing, right?
Yes.
So, it's good that they're always so helpful.
Yes.
So this is Stacie with Northwest Senior and Disability Services. If you're just tuning in, and I'm here with Keri and Katie and Alice from the Rinehart Clinic, and we are talking about all the fun things that the Rinehart Clinic is doing to engage in the Year of Health and Wellness. So you also had done some hula hoop challenges.
We did.
Let's talk about that. I want to hear more.
Oh, that was so fun. That's one of the first ways that staff engaged with the Year of Wellness. We, a couple of our social workers, kind of facilitated making hula hoops. So a lot of staff made their own hula hoops, and then went out on their breaks and went out into the field next to the building and practiced. And then we had a competition. Our winner was Tara Marzano, who is one of our social workers, and she hula hooped for almost 12 minutes.
Wow.
It was amazing.
And it wasn't just like around her arm, which is how I'd have to do it.
No.
It was like full blown. Yeah.
Right. It was awesome. It
That's
was so
fantastic.
Much fun. Yes.
I think they could have gone longer, but we started adding tasks to the hula hooping.
Right.
Oh, to mix it up a
We
little
had to
bit.
Mix it up.
Yes.
I love it.
Yes.
So, and you can also challenge community partners, right?
We can.
And you have a challenge sitting out there, right?
We do, to Big Wave Restaurant.
Oh, okay.
Yes.
And you're just waiting to see if they're going to respond and
We
take
are
that
waiting.
challenge.
We are waiting.
I like it. That's fun.
Yes.
So, in other news about the Rinehart Clinic, you have a Reading for Wellness program coming up that's going to start here at the end of this month, right?
It is. We're meeting at the Rockaway Beach Library, and we're reading the book Gulp. It's on the 29th from 4 to 6.
Mm-hmm. And tell me about the book, Gulp. I haven't heard of that.
Well, it's actually kind of a funny book about the digestive system, and it covers all aspects of the digestive system. So, and the
Way
author...
to get real pretty quick, right?
It is going to get real.
Don't you want to discuss that with your neighbors?
I want to discuss it now.
It's going to be it's a really fun book, and I think it's going to be a great reading group.
Good. And a couple times this year, starting on March 29th at the Rockaway Library, and then again later this fall as well.
We're doing a reading group actually on August 12th. When I spoke with the Tillamook Library, they wanted us to include it in the adult reading program. So we're doing it August 12th, and we're doing a book called Organic.
Oh, okay. That sounds interesting, too. Well, and then if people want to register, how do they do that?
They need to call me at the clinic number, which is 503-368-5182. And I have books available for them to check out. And
No charge?
There is no charge. It's absolutely free. It is limited. Space is limited. And if I had an overwhelming response, we might add another group later on this spring. But I would love for people to call and take part in this, and I could get a book to you.
Yeah, that's fantastic. So that starts March 29th, and you can call Alice Jeffers at the outreach coordinator at the Rinehart Clinic. And again, that number is 503-368-5182. But you can call the Rinehart Clinic, and they can direct.
Yes, that's
to
the main
right
clinic phone number.
So fantastic. And then what else do we have going on? I think right now with the Year of Health and Wellness, it's the end of the first session. How'd you do on the session? Are all your people going in and online and logging in and everything like that?
They are. I think we're actually first place as far as points, which is pretty exciting.
That's very exciting.
Yes, we have some
love how engaged you are.
Right. We have very engaged people. And the pharmacy is really engaged, too, which is awesome.
Yeah. So people can go on to Tillamook County Health Matters.org and they can register. And what's important to know about that is as the first session ends, we'll be looking at, they'll have random prize drawings as well as for companies that have agencies that have engaged in the program as well as individuals. They have t-shirts, massage gift certificate. There's all kinds of fun things that you can win as prizes, and we'll be announcing those, I think, at a county commissioners meeting at the end of the month, and then, of course, calling people individually as well. So, so what's most important to know about that is as the first session winds down, you'll have that first week in April to go ahead and get started with registering for the second session if you haven't done that yet. And again, that's TillamookCountyHealthMatters.org. And you can contact Northwest Senior and Disability Services, the Rinehart Clinic, if you need any help with that, as well as, of course, all these different agencies are involved in and jumping in. So very exciting stuff.
Stacie, we're also going to have a sign-up station at the event today. So if anyone going to the event would like help signing up for the Year of Wellness through the Tillamook County Health Matters website, we will be there to facilitate that.
Fantastic. Other great news. What else is going on up north?
Well, the Rinehart Clinic is one of 2 clinics in the state that are participating in an oral health integration program. The program is sponsored by the Oregon Primary Care Organization, and what it is when a child comes in for their well child check, we check their mouth for early signs of cavities, and are able to refer them to a dentist if needed, and we are partnering with the Tillamook County Health Department for that. We also provide fluoride varnishes for children. Our target audience is young children. Our target, you know what I'm saying.
Demographic.
Yeah,
I knew I was following you.
So yeah, we've got the opportunity to go into a couple of the schools in North County, and we've got a tooth fairy, Keri.
That's me.
Scott.
I'm the tooth fairy.
Are you?
Don't tell anyone.
How have we spent
my
the
downtime.
last 20 minutes talking and that didn't come out? That's fun. Do you have like a little wand?
I have a little wand for when I'm small and I go in their mouths and collect the teeth. But I also have my large wand so that I can.
On a side note,
them.
ew. But yeah, that's great. I'm just kidding.
She might also be wearing a tutu.
Not at the moment.
Yeah, just to clarify, not right now. So do you have actual clinics where the kids come? Do they just make an appointment and come into the clinic then,
yes.
Or do you have a special day that you do just oral health for kids, or how does that work?
So right now we have integrated this process just into your everyday visit. It's nothing special. We're just adding it on. We're doing head-to-toe health. So at this point, we're going to be looking in your mouth as well, making sure you don't have any signs of cavities, because that is going to affect your all-over health.
It really does.
It really does. It's quite amazing. We're rolling this out right now to the young population, but it's going to happen with everyone. So don't be surprised if at your next annual visit we have you open your mouth and take a look.
That is incredibly exciting for seniors as well.
Yes.
There's a huge need for dental health, and it can really impact all kinds of things like cognition and overall health and infection, and so that's very exciting to know that that's coming down the pike. And also that you're one of 2 clinics in the state. So was this grant funded then, or?
It is grant funded. Qualis is actually the funding organization, and it is a national organization, but it's Oregon Primary Care Association that made it available to us and really have supported us in the process.
Fantastic. Well, let's take a little break for another word from our sponsor, Tillamook Regional Medical Center. March is National Nutrition Month, and nutrition experts at Tillamook Regional Medical Center are ready to help you improve your diet. Getting the vitamins, nutrients, and minerals the body needs is important to maintaining health. Eating at least 5 servings of fruits and vegetables each day can help prevent chronic disease like diabetes, hypertension, and obesity, all of which are linked to heart disease. Boost the amount of leafy greens, citrus fruits, and berries you eat. Eating a handful of nuts, legumes, seeds, oats, or whole grains each day is also beneficial to health. Cut out soda, potato chips, pastries, and other foods high in sugar, fat, and carbs that can lead to high blood pressure, high blood sugar, weight gain, and inflammation. In addition to eating well, try to get at least 30 minutes of daily activities to keep extra pounds off the tummy and fight chronic diseases. To find out more, talk to the experts at Tillamook Regional Medical Center. They are committed to the health and wellness of our community. That's fantastic. And actually the hospital, Ginny Gable, is getting ready to start the chronic pain class next week, and there's still spots open. So if you're interested in participating in that, then you can call the main switchboard at the hospital, the 842-4444. And the Rinehart Clinic also has Living Well for Chronic Conditions as well as the local hospital here. And I think that's going to start up I was just speaking with Tara about it yesterday. We're looking at May to start another 6-week plan. So, this is Stacie, Northwest Senior and Disability Services, and I'm here with the Rinehart Clinic for those of you that are just popping in. And we have covered a lot of a lot of things and topics so far.
We have.
And so we have some events coming up for April. It's Sexual Assault Awareness Month, so the Women's Center is going to have an event on the 5th of April. And then the Parkinson's Awareness and Minimizing Stress event will be on the 15th. Are you guys going to try and come down for that?
Yes.
Absolutely, of course.
That's going to be, it's kind of a neat deal because there's a huge Parkinson's support group. And I know some people that are in North County come down to Tillamook every month to go to it. And I've had the pleasure of partnering with them to have some events brought here. And so this month, last year we did a panel with people that have Parkinson's that are care partners and what's important to make sure that medical professionals and community members know about the disease, and if there's an emergency situation, what are the things most important. This year we're taking that to the next level, which is having some representatives from the Parkinson's Center of Oregon come and join us to educate us about anxiety and nutrition and all these different things. So that's going to be on the 15th. So there's lots of action happening all over the place.
We have a roadmap to wellness, and we're all involved.
Yes,
I like that.
Roadmap to well. That's very good.
Did you just make that up?
Off the top of my head. I used my wand.
See, there you go. In addition to that, the Alzheimer's Association is coming on April 27th, and they're going to talk the basics of Alzheimer's and difficult conversations. So I hope you guys can make it to that too. That's going to be in the afternoon from 12:30 to 3:30, and people can register with me, as well as Jenny Gable again at the hospital is going to be taking charge of that event. And let's circle back to Dr. Hassel's event today that we had started to talk about earlier in the program, but if somebody's just popping in, again, that event is at Fresh Cafe for lunch today, and then at the City Hall around the corner in Bay City. And thank you to Shayna Peterson. She helped us get the event venue for the lecture piece going in the 11th hour. So she's just been a rock star, and the team it's really neat how there's such a great collaboration from the different agencies.
Yes, it's been wonderful.
Mm-hmm.
And that's kind of what the Year of Wellness is all about, is all of the different community resources coming together, making sure that the different communities do know what's out there, who the players are, who they can go to. Mm-hmm. There are so many great things we have. Yeah. And this is about letting people know where they are, who we are, how to access these resources. So if anyone has questions about the Year of Wellness or how they can get in on these really cool events, they can talk to Stacie at Senior Services or Alice or I at the Rinehart Clinic. There are many partners. We have the North County Recreation District involved, and every every area of the county, we've kind of divided it: North County, South County, Central County. There's all the different players, and they're all involved in this. And I think it's such a great tool to get the message out.
How everyone's working together to really bring education
really
and opportunities.
It really is amazing.
I also like that the events, you go there and you get some information, but you have some takeaways that are how to apply it to your life if you so choose, so that way you're not walking away going, "Ooh, I need to deal with that. I didn't know about that situation," and then not knowing where to start. This just feels like until the community's just given us a big hug in their interest in participating.
Yes, it's so cool. And it's always baby steps. I mean, you just find something that sings to you and you start with it, whether it be a Biggest Loser contest or reducing your sugar intake or maybe just walking a little further every day.
What are some other things that we can do in regards to adding exercise and movement? Alice, sounds like you've been doing all kinds of things. Is there any tips that you have that have been examples of your success?
Well, I was part of the walking club, and the Rinehart Clinic is located on the top of a very, very steep, large hill. And I started having some joint pain. So I had to step back from that. But what I did was I started swimming at NCRD. And it's great. I'm the woman that is there early in the morning is very, very helpful. Her name's Nancy. And she's really helped me to develop a program that works for me as far as swimming. And there's so many resources that we just don't take advantage of. So those are the types of things I'm doing. And I've also started joining in the exercise group that we have in the afternoon. And we did, Katie, what did we do the other day?
So we've done everything from cardio. There's a dirty 30 workout to an upper fix to a lower fix. Some days we also tone it down with a little bit of yoga and Pilates, which was harder than we initially thought was going to be.
Okay. So you have different people in your clinic leading these little 30-minute classes.
Yes. And there's also talk about doing Tai Chi.
Okay.
And we'd love to get some Zumba in there. I'm pretty excited about trying some Zumba.
There is action in that clinic.
Yeah, it's exciting. It's very exciting.
We are movers.
Yeah.
Yes.
And part of the monthly movers through the year of health and wellness is that you can go to NCRD, North Coast Rec District, or the YMCA, and you can get a pass for a class, a free class. So that's a really good way to kind of check it out if you're interested in swimming or, any of these other opportunities. Or until you guys get Zumba going in at the Rinehart Clinic, maybe you can stop by the Y.
I've actually participated in both the one at North County Recreation District and the Y, and I've done their two free classes.
Fun.
One at each. It was a lot of fun, and both places have been so accommodating and kind.
Good. Well, I've got a couple announcements to make here as we're wrapping up for the day. Our sponsors today were Rosenberg Builder Supply and Tillamook Regional Medical Center. Happy birthday to Casey Josie. And also Monday, Lisa Ginger will be back with Tanya Wehedge. I'm sorry if I butchered that a little bit, from the Oregon State Extension Office and 4-H Teen Club and All About Animals. Senior meals are noon every weekday at the Kiwanda Center in PC. The cost is $3 for seniors and $6.75 for everyone else. There's also senior meals at 11:30 at St. Mary's by the Sea in Rockaway every Monday, Wednesday, and Friday. And also a little note here, 5 years ago today, a magnitude 9.0 earthquake devastated Japan. March is Earthquake and Tsunami Preparedness Month, and for information on how to prepare for an earthquake and tsunami event, visit the website for Tillamook County Emergency Management. Also plan to take part in the Tsunami Walkout, March 11th and 12th, and we'll have more information coming up about that event, so that if you want to participate, we can get you on the list. On a lighter note, the Vintage Flea Market and Bazaar is today and tomorrow at the fairgrounds, and it's the 31st annual, wait for it, crab races in Garibaldi tomorrow and Sunday. I'm pretty excited. Also tomorrow is the Crab and Chowder Feed fundraiser at Neoconi High School for the school's baseball program. So lots of fun things going on in the community. And I just want to once again thank Katie and Alice and Keri for all of their support and all these wonderful things they're doing for their community. Thanks for being here, girls.
Thanks for having us. It's been great.
Thank you, Stacie.